Artificial intelligence is constantly in the news, especially in the healthcare setting, and people are constantly performing these studies, these randomizations, using things like ChatGPT to determine how accurate it is at diagnosing medical conditions. Well, a recent study published by the Journal of the American Medical Association, Pediatrics, states that ChatGPT misdiagnosed 83% of children's health conditions. Now, you may find another study when you look at artificial intelligence that says that ChatGPT is finding these rare diseases that many physicians missed. So it's a very broad range of what's happening, and a lot of that has to do with two major factors, and one of them is the input and the other one is the database that it's living and breathing off of, and all of these different things that you hear around AI. The AI database is constantly changing, it's constantly growing, and more information is being added to it. But the other side of that is a very old saying within statistics and economics, which is that if you have junk in, then you're going to get junk out. And a lot of it has to do with the way that things are input into an artificial intelligence program. You may input something one way and it diagnoses or figures it out within seconds. You may input something in that has a similar thought process in your head but is typed out completely differently than somebody else, and you might get something very different. So giving a random medical condition to an artificial intelligence site and expecting it to find that really depends on how you put that information in there and then what can be determined from it. So it's really easy to get caught up in all the flashiness of AI, the flashiness of these articles that things are being misdiagnosed or things are being underdiagnosed or physicians are going to lose their role because AI is going to take over the world of diagnosis. And finding the common ground is really difficult. But again, a lot of that comes into putting in the correct information. And so I want to take a second to just specify that getting the correct information is still very much human dependent. And there's a huge need to perform an accurate and thorough assessment of an individual. Whisking into a room, looking over an individual really quickly and running back out the door does not give a very thorough assessment. And expecting a computer to pick up all these little clues and subtle hints and changes in breathing patterns and changes in the abdominal assessment is really just poor practice overall. Being able to accurately perform a good, thorough, hands-on assessment is becoming a lost art. And unfortunately, as more and more people rely on technology and less rely on actual hands-on physical assessment, I think all of this data is going to continue to become muddled, and fewer people are going to have an accurate diagnosis, whether it's in person or through AI, if the clinician at the bedside evaluating the patient is not doing a thorough job. So rather than get caught up in all the flashiness of is AI good, is AI bad, what's happening, because I thoroughly believe that there is some really good and really bad things with AI, I do believe at the core of it all, that people need to refocus on what patient care is all about, and that is the human connection to the individual in need of medical care, and to be able to connect with that person on a holistic level and accurately and thoroughly assess them, taking that finding, and if you are the clinician that maybe doesn't have the answer, looking to other clinicians or even AI to help find the answer may be worthwhile. However, got to get off of square one, which is performing that accurate, thorough assessment, connecting with the individual and looking at them holistically and not just as a disease-based condition. So hopefully that helps shine a little bit of light on the conversation about AI, but in a little bit different way. Would love to hear your thoughts on AI. Would love to hear your thoughts on how AI is growing and changing healthcare and what you think is going to happen in the next few years with AI. Thank you for watching. Have a great day.